Hello, my name is Colin.
Hi.
I'm your student nurse. I'm here to do a head-to-toe assessment on you.
Okay.
I'm gonna make sure you have privacy. Make sure I cleanse my hands. Make sure I have all my equipment ready to go. Can you tell me your name and your date of birth, please?
Emily Resoff, 10/4/1998.
We're going to check that against your ID on your bracelet. Do you have any cultural concerns before we begin?
Nope.
No? All right. And can you please pull down your mask and let me open your mouth, please? And I'm going to check your mucous membranes, your nose, your mouth. That all looks really good. All right. You would start with a set of vitals.
Okay.
And you have your vitals here. Those all look really good. Are you in any pain at all?
No.
Okay. If you were in pain, I'd ask you on a 1 to 10 scale how bad it is, where it is, if you've done anything to control it, but you're not in any pain. So we're going to move on. I'm going to assess your level of responsiveness. Do you know what day of the week it is?
Monday.
Do you know where you are right now?
Century Hospital.
Okay. And do you know what's going on right now?
Just, what do you mean what I'm here
Well,
for?
what are you here for?
Oh, okay. Yeah, just checkup.
Okay. And you already established that you know who you are. Right now I'm doing a general impression as well. You seem alert. You don't seem in distress. You seem like you take really good care of yourself, good hygiene. Your skin looks pink. It feels warm. It's got good moisture. Your skin's intact as well, and you don't seem like you're in any distress. So that's really good.
Okay.
Let me check your pupils real quick.
Alrighty.
I'm going to note your pupil size. Can you look right at me, please? You're at about a 6. That's a 6.
Alrighty.
I'm going to shine a light in your eyes, okay? Pupils are round, they're equal, and they both react to light appropriately. All right, I'm going to check your peripheral vision. Can you tell me when you see my fingers on your left side? Okay. And same deal on the other side. Tell me when you see them.
Yep.
Okay. I'm going to check for accommodation. Can you look straight at me?
Okay.
And then look past me. I want you to. And here, how about you look at my pen? Look at my pen and look past the pen. Not down.
Oh, sorry.
Look at the pen.
Okay.
And just look past the pen up here.
Okay.
Okay, there you go. I saw that.
Sorry.
All right. No, that's okay. We're gonna watch for movement too. Can you look at my pen as well?
Alrighty.
Just follow with your eyes, side to side, up and down, and diagonal. Very good. Okay. It's looking real good. I'm gonna assess your pulses. You ready?
Alrighty.
So, assess temporal pulses. Let me put this down real quick. So I can actually reach it. Assess temporal pulses. Those are good, strong, regular, equal. And assess carotid pulses, one at a time. That's strong and regular. That's strong and regular and a good rate. And check your brachial pulses. Those are good, strong, and regular. Check your radial pulses. Those are good, strong, and regular as well. Your skin's intact on both sides as well. I'm going to check your skin out the whole time. You can have your fingers in both hands. Can you feel me touching your hands?
Yep.
Yeah? And can you close your eyes? Can you tell me where I'm touching you?
Okay. Right arm.
Right arm. And
Left arm.
okay, good. Squish your nail beds. Check for cap refill. That's less than 2 seconds. Less than 2 seconds. Can you squeeze my fingers? Squeeze. Good. And good more. All right. That's intact. And while we're at it, can you close your eyes again? Tell me where I'm touching.
Right leg.
Okay. Tell me where I'm touching.
Left leg.
Very good. Okay. All right. Pupils. I'm going to listen to your heart sounds now. All right. So I would put these in my ears facing forward, but I'm not, so I can talk to you. I'm going to listen to your aortic heart sound. That's second intercostal space on the right sternal border. Listen for that. S2 is louder than S1. Pulmonic, second intercostal on the left sternal border. S2 is louder than S1. Then we're going to go down to your fifth intercostal, left sternal border, and listen for your tricuspid sounds. And then midclavicular, fifth intercostal, I'd listen for your mitral sounds. And S1 should be louder than S2 in those lower ones. Those all sound really good.
Okay.
And listen to your lung sounds now. And listen for your bronchial sounds, and those are above your clavicle. So listen to those. I listen on the other side, above your clavicle. Then I'd listen to the bronchovesicular sounds. Those are at your first intercostal on the right and left side, second intercostal, right and left side for the bronchovesicular, and then for the vesicular, third intercostal, fourth intercostal, and then fifth intercostal. Those are all sounding clear and equal, so we want to hear. Can I have you sit forward, please? All right, so I'm going to listen posteriorly above the scapula. We're going to go in 10 spots back here. If you could please adjust the camera. So we're going to listen cross, in between the scapula and the other side of the spine. Cross, down, and then way down here low, and way down here low. And I would listen axillary and axillary, and those are clear and equal.
Okay.
All right. We're doing that. Oh, I'm going to look at your abdomen now.
Okay.
All right. So, any concerns? Any pain in your abdomen?
No.
No? Okay. I'm going to raise you up a little bit. No pain in your abdomen? How about bowel movements? Frequency?
About twice a day.
Okay. Any use of laxatives?
No.
No? Okay. And how about your bladder? Any concerns with urination?
No.
Frequency?
5 times a day.
Okay. Use of any diuretics?
No.
Any abnormal odors or colors?
No.
Very good. Any sexual concerns or reproductive concerns?
No.
No? Okay. I'm going to visualize your abdomen. That looks good. I'm going to auscultate bowel sounds. Again, I'd have these in my ears. These occur every 5 to 15 seconds. I'll start in your lower right quadrant and move around. So I'd listen for like a minute. Right upper quadrant, listen for a minute. Left upper quadrant, listen for a minute. And left lower quadrant, listen for about a minute. And note those are all sounding good. I'm going to palpate your abdomen. I'm going to start in the lower right quadrant, right upper quadrant, left upper quadrant, left lower quadrant. This is your left, not mine. I would verbalize assessing femoral pulses. Femoral pulses, geez, you say this too much. Equal and regular and strong on both sides. Popliteal pulses, equal, regular on both sides. Noting skin condition all the way down. Posterior tibial, strong, regular, equal on both sides. And I would have you, can you feel me touching you down here? We've already done that down here. Can you raise up on my hands? Can you push down on my hands? Can you wiggle your toes? And I'd squish your nail beds and check cap refill. Along with that, we're going to go back up to your upper extremities. Can I have you, we're going to sit you up real quick. We're going to check those in your upper extremities. I know, it's uncomfortable when I sit you up like that.
That's fine.
All right. Can I have you put your hands like that? And I want you to push down on me. Push gently. Okay, upside down, turn upside down. I want you to push up against me. Very, very good. That's good and equal. You felt good and strong. That's all good in there. Your skin's all looking good. Now we're going to work on your gait and balance. I'm actually going to lower the bed down so you don't have too far to go.
Oh, thank you.
And before we sit you up, are you feeling dizzy at all? Not feeling
right
dizzy?
now.
All right, can you kick your legs over? You feeling dizzy now at all?
Nope.
All right, if you were, we'd give you a second to adjust that. Go ahead and stand up, please.
Ready?
Can I have you put your hands out in front of you?
Okay.
Turn upside down. Close your eyes. We're going to have you stand like that for a minute and make sure you got you're holding good balance, which you are. Okay, you can open your eyes and put your arms down. I'm going to check your gait and your pace. Have you walk. That looks pretty good. You're going to trip over everything and walk back. All right, now we're going to play some patty cake. I want you to do what I'm doing. Good. You're doing that. You can move everything. All right, you feeling okay?
I think so.
Go ahead and have a seat in bed. Get comfortable. That's the end of my examination. Everything is looking really good. And if you need anything, let us know. I'm going to go document everything.
Okay. Thank you.
Cut.